So this is a case treated by Dr. M.B. Gururaja sir, psoriasis. Can you please take us through the case, sir?
Okay, this is one of the case referred from other doctor. She has been suffering from this condition quite long, and she's been taking Western medicines or allopathic medicines quite long time, but she was not having any relief from that. So when she approached me, then I straight away suggested certain medication for that. And usually in these type of skin conditions, I go by strict diet control and what should be eaten and what should not be. That is a very important aspect. I made them to eat only pure vegetarian diet, avoid all non-vegetarian things, and as well as even all oily deep fried items. Anything which is oily fried, avoid all those things. And even the rich source of spicy masalas and these things should be avoided. So once I make them to eat only the bland diet of pure herbal source and even vegetarian type of things, and all non-vegetarian things and deep fried is avoided. And of course, with the medication, definitely the things will change. And this is a case wherein after 1 month of course without any shodhana, that is one of the important aspect I want to highlight, because even many times we feel that there are a lot of shodhana has to be done for skin conditions. But here in these cases, if they stick on to the strict diet, what we mentioned, and consume the medications and apply the things which is given to them, definitely the change will be evident and it can be seen.
First of all, so this you diagnosed it as a case of psoriasis, sir. And can you please explain like how do you approach psoriasis? Like which are the internal organs or dhatus and srotas that you concentrate upon practically when a patient is in front of you?
See, when it is for the purpose of easy identification, I use the term psoriasis because it's very, even for the counter people or population, they will understand only that word psoriasis. If I say it is Eka Kushta, or Kitipa Kushta, or Vata Kafaja Kushta, then they may not be able to identify it or recognize it. So for that purpose, I stick on to the standard pattern or universally known or accepted word psoriasis. That's the reason I go for it. Otherwise, it is a typically a Kitiba Kushta, we can call it in Ayurveda, where the dominancy of Vata and Kapha is there. So in this case also, there is a clear-cut discoloration, there is a severe itching, scaling, and dryness. So dryness and scaling is due to Vata and itching is due to Kapha. So because of these two combination, the things are happening. So then when we convert, change the things particularly with respect to by using colon cleansing materials, cleaning the bowels, as well as even changing the diet pattern and introducing blood purifying materials, definitely the things will change. And what we understand here is the important aspects where it is been hampered here in this case are particularly rasa, rakta, and to some extent it is typically lasika is also involved, or we can say it as rasa, rakta, lasika, to some extent even mamsa. So based on these point, I usually concentrate on what medication we should select. So in this case, better I thought was Aragudadi Kashaya. The reason for that Aragudadi Kashaya is a very good Kafahara as well as colon cleanser, and as well as it is very good against the itching. So that's why Aragudadi Kashaya has been selected, and it is a classical preparation, Kafahara in nature and bowel cleanser. And of course, one of the best, Araguda is one of the best Dharmaroga Nashaka Dravya. So based on these parameters, I selected in this case Aragodadi Kashaya, 10 ml 2 or 3 times a day, depending upon the body weight. We'll usually calculate on that part of it, and severity of the Roga and Rogi Bala. Based on that characters, I select 10 to 15 ml. Then comes the important drug which I use it, that's a capsule Proskin, which is in oil extracted or lipid extracted material containing Guduchi, Katuki, Vasa, Nimba, Haridra, Jyotishmati, and even to some extent Mandukaparani, Manjista, Gugulu, all these things are there in this. This is one of the important capsule produced from Panchakarma Pharma, which it is in a form of a typically band sealed capsule. So it's a very typical one, hard gelatin capsule, but containing a lipid inside, and it has been sealed within gelatin coating. So that's what we use it. And this proskin is one of the important material, which is almost having the content of Panchatikta Gulugrutha with the fortification of added materials. So definitely it will going to improve the skin conditions. So because of it is a Tikta Rasa and Gugulu, Gruta and these combinations will definitely suppress the Vata to a large extent. So this drug I usually give this drug in cases of skin conditions as a before food combination. It is to be taken on empty stomach. So usually 2 capsules before food in the morning and 2 capsules before food in the night. That's the usual way of consuming. So this is the next drug, the Proskin. Next one is Soharb. This is also containing almost a similar type of things, but it is a dry powder capsule, which I usually use it as a somewhat like a Samudka type of dosing. So before food, I'll go with Proskin like lipid extract, and after food, I'll go with the Soharb. It is a dry powder capsule, so something like sandwiching of the doses. So in order to overcome the proper dosage required for the condition. Then for outside application, I use Kutaja Taila and Bruhat Dantapala Taila. Both are the from 2 different companies, produced it based on the Banutapi type of paka, that is from the Surya Paka type of material. They are not really boiled in fire. Both are produced from the sun exposure, cooked under the sun. Kutaja Taila and is containing only purely Sri Kutaja, Raitia tinctoria, and Bruhat Dantapala also mainly contains Raitia tinctoria, and along with that some Tila combination, as well as sometimes even certain Manjista and such type of drugs are also there. So these type of combination, when we use it on external application, definitely it will reduce itching as well as scaling. So when these combinations have been used continuously with a strict diet pattern, and we are getting a very good results, relieving itching as well as scaling, and even scarring also reduced even just a span of 1 month, even without any shodhana.